There was a mother's son who was getting a procedure done, and the procedure was going to be straightforward and turned out well, and he was having a great recovery. Although he did have a PCA, which is a pump-controlled Anglesia pump that helps with pain and releases morphine on the command of the patient. Then one day, the team increased his dosage of morphine since he was having some discomfort. But the nurse that was taking care of him suggested not to, but the pain team disregarded that. It affected her son's behavior as he would doze off during the conversations that they had together. And it concerned the mother, and the mother went to talk to the charge nurse about it. And the charge nurse affirmed that it's okay, it's natural, it's just something that happens when patients go under morphine. Yet later that day, the mother was given a call letting her know that her son had gone into cardiac arrest, and he did not make it. She didn't realize that would be the last time that she would have that chance to talk to her son, the last conversation ever. My name is Andrea, and today we are going to be discussing and focusing on patient safety. We will go over answering what is patient safety, why there's an issue in patient safety, and solutions in providing effective patient safety. So first off, what is patient safety? Well, according to WHO, World Health Organization, they define patient safety as the prevention of errors and adverse effects to patients associated with healthcare. Patient safety affects everyone who has ever received any care from a healthcare system, and even family members of those who do receive care. The issue has been noticed is the effects not providing patient safety, which leads to medical errors, decline in patients' health, and even deaths. One of the leading causes of lack of patient safety is communication. It is commonly reported that 1 in 10 hospitalized patients experience harm, with at least 50% preventability. That's a pretty high percentage of preventing this. WHO has recognized that patient safety has become an epidemic across the world, and because of this, they have made a commitment to improving patient safety. In 2004, launching a World Alliance for Patient Safety as a solution. Some other solutions that are being made are nonprofit companies such as a joint commission holding standards for health organizations in the United States, which include patient safety. Effective communication is critical to the successful delivery of healthcare services, as said by the Joint Commission. Not many realize how important it is providing patient safety. After having a discussion with a nurse I work with, they have told me their personal experience as how lack of communication affected his father's care. His father had been feeling very weak, and he was being treated for high blood pressure. But as it turns out, when the nurse went to go visit his father, he saw all the medication he was taking, and it was alarming to see that he was taking prescriptions and 5 medications that were all very similar, and it was a cause as to why he was feeling weak. And the nurse had found his father was being overprescribed the same medicine, treating his high blood pressure. When taking his medicine, it affected his health even more. The nurse was upset, and you can only imagine that the doctors had all prescribed similar medicine and had not taken into account the other medication his father was taking. When caring for a patient, it should be a team effort. Everyone should be communicating with one another and even to the patient so they are aware and are informed as to the care they are receiving. This is why communication is vital to providing care, to prevent situations such as a mother who lost her son.